Hello, my name is Deja, and this is my professional standards video. So, what is delegation? According to the joint statement presented by the American Nurses Association and the National Council of State Boards of Nursing, delegation is defined as the process for a nurse to direct another person to perform nursing tasks and activities. And that statement was published in 2019, and an example of delegation would be a RN assigning a UAP to do blood sugar checks, but the RN still assumes responsibility for making sure that that task gets carried out. Okay, so in Louisiana, where I work as a registered nurse at Tulane Medical Center, delegation is described as entrusting the performance of selected nursing tasks by the registered nurse to other competent nursing personnel in any selected situation. And we could just look at this slide. So once again, the licensed nurse still retains overall responsibility and accountability while assisting the RN prioritize tasks for improving efficiency. And in Mississippi, where I work, the registered nurse who delegates the task continues to be responsible for appraising the care given and providing guidance and assistance needed in order to safeguard the consumer, which is the patient, of health care. Now let's discuss the scenario. The scenario that occurred was the RN instructed Sally to go and discharge the patient and discontinue their IV. Well, Sally should have been supervised directly by the RN because, for one, she's a nursing student and she's not licensed. And once again, the RN, she delegated the task, but she is the one that is going to retain and uphold those responsibilities for Mr. Cooper. And I mean, as a nursing student, no, she should have been definitely supervised by the RN in discontinuing Mr. Cooper's IV. And in discussing a personal scenario of mine, while I was in clinical, a nurse instructed me to give medication, an IV narcotic IV push, and this is definitely way out of my scope. No, as a nursing student, I cannot give Dilaudid IV push. No way. So of course, if had I not known and been familiar with my scope, I probably would have went down there and done it. But because I knew better, I definitely did not do that. But these are just some guidelines that were presented to me in nursing school by my nursing instructors. I'm gonna just read through a few of them. Number 1 says the RN must be physically present on the unit whenever the student is functioning in the clinical management role. Number 7 says the student may access, flush, and draw blood from a central line, Mediport, Hickman, Guashong, under the direct supervision of an RN. Number 8 says the student may administer only certain IV push medications, and the student is permitted to administer only the following IV push medications, such as diuretics, steroids, antiemetics, antibiotics, protonics, Nexium, Toradol, and Reglan. Nowhere on there does it says that a nursing student can give IV push narcotics. So, of course, in relating that to my own personal scenario, no, you have to be familiar with your scope, even as a nursing student. And we had to sign and date it. State-to-state delegation. Okay, so I want to talk about Texas. In Texas, nurses can, nurses can delegate to UAPs to administer sub-Q insulin, which is something that I just discovered. I did not know in Texas UAPs could administer insulin. Where I work in the state of Louisiana, insulin is a high alert medication. 2 nurses must verify the dose and co-sign on the documentation that the insulin was administered safely and appropriately. But in Texas, UAPs can administer sub-Q insulin in a non-acute setting. In Mississippi, UAPs cannot administer insulin, but they can check blood sugars in Louisiana and Mississippi. But in Texas, they can actually physically give sub-Q, nasal, and insulin via pump. The more you know. Thank you for watching my video.